when the whole point of insurance is to mitigate against future risk. And when people buy an insurance product, they ought to be getting what they pay for. So it goes without saying that you ought to be able to get what you need when you need it without your company dumping you. This is, I think, why the Republican alternative had this provision in there where it actually eliminated lifetime caps. Now, some of our members may vote for this, some may vote against because of the context in which this is being done. So I think there's a good argument here that you'll get a vast majority of people on both sides of the aisle agreeing with the need to eliminate lifetime caps. But what we have a problem with is the context that this is being done in. Under this legislation, one person, the Secretary of Health and Human Services defines and decides what insurance is, what you can buy. That is too much power to give to one person, but more importantly, it will reduce choice and competition. So while we would agree that there needs to be parameters and rules within which the marketplace can operate, we would disagree by saying that this just goes far, far, far too far. And that is why, in this context, we have a problem with these ideas. The idea that we should supersede states' rights, even if you have a state exchange but which is federally mandated, that really negates the whole purpose. From our perspective, these state-based exchanges are very little in difference between the House version, which has a big federal exchange. So putting the same rules in place. You're telling people what insurance is and what it is not, what you can buy, what you cannot buy. And that is where we have a big problem with this. On top of it, you're not only defining what insurance is, what it is not, you're making people buy it. You're mandating that everybody buy this product. And then as you mandate that people buy this product, you will give them subsidies to help afford this product, which CBO estimates will be more expensive. But you got to go in the exchange to get the subsidies. And so we're corralling people into this new entitlement, a new open-ended entitlement, which quite frankly, I don't think anybody knows what will ultimately cost. I mean, the full 10-year cost, once this is fully phased in, is $2.3 trillion. That's the spending side of it. But what we're basically saying to people making less than 400 FPL, or in real language, it's about $100,000, is don't worry about it. Taxpayers got you covered. You consume any more than 2% to 9.8% of your income, your fellow taxpayer will bail you out and cover the rest of it. And so we're defining what insurance is federally. We're mandating what it is. We're limiting the options of what you can buy. And we're basically regulating it all from Washington. And we're making you buy it, and then we're going to subsidize it, creating a brand new open-ended entitlement at a time when we don't know how to pay for the entitlements we already have on the books. And so it's the context in which this is done is what we have a problem with, not the actual idea and the policy of removing lifetime caps. With that, I'll yield our time.
Gentlelady is recognized.